Thank you. Thank you so much, Joshua, and thank you everyone for joining us today and hearing about the work and the learnings of the Canadian Grief Alliance. I'm looking forward to getting through the slides and being able to have a conversation with all of you. So really hoping that you come with questions and things that you want to share about grief in Canada. So with this presentation today, Paul and I, on behalf of the Canadian Grief Alliance, are hoping that you come away with an understanding of the aims and efforts of the Canadian Grief Alliance, what our ambitions are and what we've been up to have some sense of the needs and concerns of grieving people in Canada through the work that we've been doing, the surveys and the grief chats, et cetera, and to share with you the top needed actions that we're recommending to Health Canada around an action plan for grief in the country. Next slide, please. So curious to know, just to take a moment and do this poll, what would you say? How would you rate your level of knowledge on grief in Canada before we begin today? Looks like we're stalled at about 10 people to go. Esther and Joshua, do we hang on?
No, we can proceed.
Okay, thanks everybody for answering the question. And I've got a share results button, so we'll see there. Looking at the group who've responded, the largest group feeling somewhat knowledgeable, about 10% very, and close to 20% not so much. So hopefully that we all walk away with a bit of learning today. And I include myself in that. Thank you. Okay, I think next slide. So a little bit of background on the Canadian Grief Alliance. We are a coalition of grief and bereavement people, leaders and people from around the country. We have input from about 170 health organizations across the country and have been convened by the Canadian Virtual Hospice. We, at the outset of the pandemic, aimed to advocate for a national grief strategy in Canada and have been advocating, lobbying for this since early 2020. I forget what year, Paul may add, received $1 million from Health Canada to develop grief literacy resources in the country and develop a national action plan. And so those things are part of what we're going to give you an overview of today. Our purpose as members of the Canadian Grief Alliance was, as I said at the outset, to respond to pandemic-related and affected grief. So thinking about how grief and loss landed and was navigated through the pandemic related to COVID losses and deaths, but also grief in general through that time. To improve access to grief resources and services, so sharing materials and access to services. And then I think a really underlying sort of fundamental aim of the Canadian Grief Alliance is to advance or improve grief literacy in the country. Next slide, I think, is about grief literacy. So wanting to say, what is grief literacy? In my definition, a little looser than this one, is just to improve the ability to understand loss and grief, and not just understand, but be able to act on it. So for all of us to be able to recognize and know what it is, but also what to do with it, how to respond when it happens to a family member, a neighbor, a colleague at work. The definition that we use is from Lauren Breen and al. In 2020, and it is grief literacy is defined as advancing or increasing grief knowledge in order to enable the general public, but also professionals, to notice, recognize grief more readily, to seek out more relevant information, and to adopt support. So again, understanding and access. I think our aim as the Canadian Grief Alliance is to improve grief literacy broadly across the country. It's ambitious, but we're working away at it and hoping to bring some of you on board. Next slide. Paul, I think from here, I'm going to hand it to you and I'll pick up later.
Okay, thanks very much, Marnie, and thanks, Joshua, for inviting us to participate in this, and thanks everybody for coming and listening to us. So one of the things we did as part of this project that, as Marnie said, we've been at for a couple of years was we did a survey of Canadians where we asked people who had experienced grief to tell us a little bit about that experience. And this is by far the largest poll of Canadians about grief that, so far as we know, has ever been conducted. And it was an opt-in thing, so it was people who were predisposed, I guess, to be thinking of the feelings they were experiencing as grief. But I think it does give a lot of insight into the way people in Canada are metabolizing their grief. So, I mean, I think the big striking thing was that half of the people who responded to our survey said they didn't feel well supported in their grief. As we'll see later on, I think on another slide, people do think they got support from their family and friends, but they don't feel well supported. It doesn't meet their needs. Like almost as many people, just over half said they felt their grief wasn't well recognized. And this is something that's really interesting to me. Over 90% said that being asked about their loss was helpful. And I have to say, as somebody who's not professionally, doesn't come to this work from a professional perspective, but just an ordinary person who's experienced grief, I think that this is something that I made me reflect on my own behavior over the years. Like, how many times have I thought, well, I'm not going to ask this person who's lost somebody or lost something in their life because it's going to upset them. That's not what people are telling us. They're telling us they want to be asked about their grief. And that doesn't mean that people do want control over when and to whom and how long and what aspects they want to talk about, but they want to talk about it a lot more than as a society we're creating the conditions for them to have that experience. Next slide. So one of the things that we are very concerned about is that, grief has covers more things than traditionally we think of. We just think of grief as something that happens when you lose someone who's close to you, a friend or a family member, that they die. But in fact, what we found through the survey, that people identify as grief all kinds of other forms of suffering, I guess I would say, that occasion grief. A big one or after an actual death is the anticipated death. Somebody close to you, and we experienced that certainly in our family when Suzanne was I guess 2.5 years. She was at stage 4. We knew that she was going to die, and that grief is very profound and not always fully recognized. Death of a pet. We just gone through COVID when a lot of people were isolated off, in some cases, they're isolated with their pets. And, death of a pet can really be a profound loss that is destabilizing to some people. Loss of a relationship, loss of physical or mental health. So you're deteriorating. Somebody who has Alzheimer's, somebody who has other degenerative disease, loss of sense of self, confidence in the future, loss of a dream or goal, job, career, business, financial stability, loss of a pregnancy. And this is one around which, of course, there still is quite a profound stigma, talking about a miscarriage, for example, or other kinds of misfortunes that can happen to somebody who's pregnant. So what we really see is, yes, the most prominent cause of grief is loss of somebody close to you, but there are all kinds of other sources. Next slide. So, as I referred to earlier, most people say they're getting some support from their family and also from friends. Um, uh, but what we're seeing is that there are some kinds of support that are much more effective than others, so that we're finding that support from family, friends, grief counselors, and support groups, for example, are more helpful. And there's differences between those, by the way, but they're more helpful than, say, helplines or employment assistance programs. And I think this is something that we need to deal with employers, because a lot of people were saying, that they, in effect, they turn to their employment assistance program for help, but they don't find it there. Um, Something we found, which is quite disturbing, is that men are doing less well than women in dealing with their grief and with finding support for it. And a lot of the traditional sources of support for people who are grieving, and I've just picked out one or two here, but for the family physician, for example, a third of men found the family physician unhelpful, compared with just a fifth of women. So, but this was true across a lot of dimensions: priests, ministers, spiritual counselors of various sorts. Um, Half of men found their hospice grief program unhelpful, compared with just really 1 in 10, a little more than 1 in 10 women. So there you see a profound difference. For some reason, the services and the supports that exist are not finding and helping men the way one would hope. Next slide. So here are some of the things people said to us in our survey, where we just asked people for some of their thoughts about their experience. One person said, "Ask me about how my son lived, not how he died." Here's an appeal for a conversation, but a conversation that's shaped in a way that that individual feels would support them and help them. Ask me how I'm doing with my grief, even if it's been a while. This is a big thing, that the support for the grieving, for people who are grieving, often falls off after, let's say, the funeral, or after a month or two, or certainly after a year. Many people are still feeling very profound grief, at a time that other people feel, well, you should be back to normal, you should have recovered, and that it's over for you. And what we know is that for most people, perhaps, profound grief is not something that ever disappears. It may change its role in people's lives. It may become more manageable and less devastating, but it's not something that goes after a week or a month or a year for many people. Another person talked about how isolating grief is, how devastating it is, how people you think will be there for you are not. Very common experience that people say that the people they had hoped they could depend on didn't show up. On the flip side, we hear the opposite too, that people get support from unexpected quarters, that people that they didn't think they would be depending on step up and help. The second year losing my husband was so much harder than the first. This is, what I was touching on a second ago, that we have, many people have preconceived ideas about how long grief remains a powerful force in people's lives, and our intuitions may be wrong in many cases. Next slide. So, 5 takeaways from our survey. People, the first one, maybe I could phrase better. It's not so much that people want to dialogue on grief in the sense of some meta conversation. They want to talk about their grief. They want to talk with their friends, family, and other forms of support about the experience that they're having, and sometimes and often about the person they've lost or the thing they've lost. Um, there's a disconnect between what people need and how others respond. This is, what I was referring to a few minutes ago, that I know that I've done this thing in my own life where I've sort of unthinkingly pushed the issue away, instead of standing up for people. I've turned my back. People want more grief support. One size does not fit all. I mean, it's very clear that, if you have a support group, that somebody who's just lost a child may not fit well with somebody who's dealing with a parent who's succumbing to Alzheimer's, may not fit well with somebody else who's has someone who's involved with risky behaviors or whatever. And non-loss grief, non-death loss and grief are significant. But we really don't have as many formal supports for them. A lot of our supports are defined around death. Many of them are offered by hospices, and they're definitionally for people who are experiencing death-related loss. Next slide. So we also did consultations with professionals in the grief area and with people who provide grief services. We talked to people in all the territories and provinces. We talked to many organizations, 184 attendees, many one-on-one conversations with people who have specific preoccupations or bases of knowledge. Next slide. I think the next slide just shows you a bunch of the kinds of organizations we talked to: the End of Life Doula Association, the Elders and Knowledge Carriers Circle, Cancer Society, Canadian Alliance of Grieving Children, professional groups, and so on. Next slide. So some of the key themes we got from these consultations was that many of the people we talked to said that we really need to, and this goes back to what Marney talked about, grief literacy, that we need to expand public education so that people who experience who are grieving understand better what they're going through, and the people around them understand grief better so that they can support them. So we heard from many people that they'd like to see grief literacy taught in the schools and just more broadly in society to normalize conversations around death and dying. And anyone who's contemplated those kinds of conversations know they're difficult, but they're also really important. We heard that there needs to be better access to grief supports. There are lots of underserved regions. The rural areas typically don't get served as well as urban areas. First Nations communities, recent immigrant populations. There are lots of different, the list is almost endless. We have strong supports in certain places, for example, for people around cancer care, for example, but you may not have similar support for people who are dying from other diseases, and certainly, as I say, not for people who are grieving for non-death related reasons. We heard a lot of people who are in this space saying they needed more money to do what they think they could do and help the people they think they can help. And there need to be specific services for children and youth who digest and display their grief in very different ways than adults, and sometimes in ways that adults have difficulty understanding, because and so sometimes there's grief which can be as because it's so poorly understood. And another big issue is for frontline workers, healthcare professionals. They need to, in most, whether it's nursing or social work or medicine, there's little or no formal instruction about grief, and many of these people encounter the grieving people, and but they're not really prepared for it. And I should say too that we don't have enough support for healthcare and frontline professionals who experience their own grief. But this was particularly profound during COVID, when people were seeing a lot of terrible things in the course of their professional work, and their suffering was not supported, and that leads to burnout, and it leads to difficulty in people's own lives. I think, is that the end of, next slide? I think I'm handing back to Marnie. Yes. Thank you.
Thank you, Paul. And thank you everyone for the conversation in the chat. I'm appreciating that as well, trying to keep up. So I'm going to speak to one of the things that we've been doing as part of the Canadian Grief Alliance, which are grief chats. It's a webinar series that we've been doing for about a year and a half, where Maxine, a PhD social work prof, but also ex-palliative care inpatient unit counselor, together, we are responding to questions that people submit. We've done 30 grief chats so far, 6 of those in French, and some special topics and some regulars. So, you know, some of the special topics that we've done so far, you saw in the earlier slide from Paul that I think number 3 grief that people identified was pet loss. And so we did a grief chat specifically focused around people's questions about grief following the loss of a pet. And we had a veterinarian who's involved in end-of-life care join us. And if it was not the most highly attended one, it was at least the second most highly attended grief chat that we did. So just want to signal to all of us that are intersecting with and supporting grief out there that the loss of animals, companion animals, is a profoundly impacting experience for people who care for them and who are connected with animals. So keeping that in mind. These webinars are not a typical webinar. So Maxine and I are not doing a bit of psychoeducation or a presentation at first. We invite people who register to submit questions ahead of time. And then Maxine and I are responding live together to the questions that come in. I wanted to just signal that I think one of the wonderful things that's happening in these grief chats is that we're seeing a kind of community build up around them, where as we're going along each time, I would say a third to a half of the people who come have come to one or many more. And there's a lot of dialogue and mutual support that happens in the chat alongside of the grief chats that we're doing. So in the moment, people are responding to each other and sharing resources and reassurances and really comfort for each other, which I think is lovely. Next slide, please. Some statistics or details about these grief chats. So far, we've had about 1,600 people attend the grief chats that we've done. So over the course of those 30, about 1,600 people, with still more to go. The registrations range, depending on the topic and the month, I think, from in the low 60s to close to over 600. And again, topics like pet loss have been really big. Although we have people register, the attendance when we actually do them live is some percentage, lower percentage of who's registered. So you'll see when we do them, 19 to 250 are showing up. Everyone who registered gets a recording of the grief chat sent out to them by email. So even if they aren't able to attend, they will receive that recording and be able to listen to it at some point down the road. They're also all posted on the Canadian Grief Alliance webpage, so people can go and see what the topics were and go ahead and listen anyway. We have been doing some kind of feedback survey of the grief chats, and of the people who are coming, over 90% are finding them extremely, very, or somewhat useful. Over 90% say that they're finding strategies in the grief chats that they can apply to their real life experiences of grief. 98% said they'd attend a future. And again, that's what we're seeing. Lots of repeat people over the months that we're doing them. And over 90% said they'd recommend them to others. Next slide, please. Bear with me, everybody. With my kids on my kitchen table, tried to do some theming of what are the sort of questions that we're getting, because I know Maxine and I both feel like we see some themes. I didn't get to do this work with her, but I think this is a fairly close approximation. So I've organized the themes of the grief chat questions into 4 categories: who, what, how, and when. And so this first slide covers a couple of them. This first one I'm calling who, and I would say it's kind of the biggest theme that I'm seeing. And these questions sort of center on the unique or personal context or nature of the loss. So loss of a spouse, loss due to drug poisoning, disenfranchised grief, those kinds of sort of unique characteristics around a loss experience. And so I've given you an example of a question. Because my father was abusive, everyone assumes that I'm happy he died, but I'm actually really sad and angry. I don't know what to do. So an example there around the who, for what. This is around sort of what's normal and okay in the experience of grief, and that might center on emotions, thoughts, how grief impacts relationships or belief systems, physical responses to loss. So questions really around like what's normal or what to expect. And here's an example of somebody, I'm in such a fog all of the time. I even forget where I'm going sometimes when I'm driving. Is my brain ever going to work normally again? Next slide. So these last two are how and when. So the how is really people looking for what's the best or the right way to grieve. Like what's the recipe book? What's the rule book? What should I be doing? And that can relate to themselves, their activities, their orientation to their life in general. So a person here saying, I try to be strong and generally keep busy, but some days I struggle to even leave my house. Is this normal? And then this fourth and last category, when. So how long is this going to take? What's the timeline? When do I feel better? What to expect? So my friends think I should be over it by now, but I still have really sad days. When will my sadness end? Or I don't feel ready to have another pet, and I'm not sure that I ever will be. My husband says we need to move on. How much time should I wait? So you can see there are questions that are really about the sort of how long is this going to last? What should I expect? When does this shift or change? Next slide, please. Oh, this one I thought to give to you, Paul, since you've been doing all the hard work of writing this up for us. Back to you.
Okay, right. So we are in the process of finalizing a set of next steps that we think that should be undertaken on in terms of supporting the whole grief literacy and services project. I mean, one of the things that's very clear is that we are way behind countries such as Australia, Ireland, and the UK in terms of research networks, public and professional literacy, government involvement. We think that one thing that could be done would be on the model of Grief Australia, set up a kind of a center that could develop standards, develop teaching, could provide, for example, in the situation of COVID, for example, Grief Australia, the federal and state governments in Australia turned to Grief Australia and said, like, stand us up some programming, give us some resources that we can help support people's grief in this situation. So we need to, we also need to build the infrastructure to support grief work. So we need to have better coordination across the country. People across the country don't necessarily know what others are doing. We even found in some provinces during our consultations that somebody in one part of the province would be in the group chat would be saying, can I get a hold of those materials because they'd be hearing about something that was happening elsewhere. So we need better coordination, and we need to build up community-based efforts to elevate grief literacy and support. That you can have a big advertising campaign, but I'm not sure the degree to which that moves the needle. We have seen in Nova Scotia, in particular, the model of really community-based projects that happen over the course of a particular week in the fall, where there's everything from people going on walks for pets that they have lost to dinners for absent friends to sessions about grief literacy, as I participated in one in the Halifax library. There was a display of people who have commemorative tattoos for people that they've lost. All of these things help generate a conversation and get the media involved and get people talking about grief. And that's one of the things we really want to do, is to bring grief out of the shadows and into the conversation. And if I can just say, at the beginning of the pandemic, it was very striking to me that I was doing a lot of, for the Grief Alliance, a lot of conversations with talk show hosts who are not necessarily the most sensitive and sympathetic people on the face of the earth generally. Um, I think just about every one of them, in the course of our conversation, started reflecting on some experience they had personally had around grief. That's not something that you normally hear on the radio. And those are the kinds of conversations we have to start having. Next slide. I think this is back to you, Marty.
Thank you. So these are a couple of infographics that we've created as the Grief Alliance. So the grief is just wanting to normalize all of the different flavors and shapes and colors and experiences of grief. And then the next one, ideas to support someone, because as we've seen in our survey, people want help. They want their people to recognize and respond, but I think often we're not sure how. So this second infographic was meant to provide people with a little bit of a roadmap or some ideas for how they might respond if someone in their life was grieving. They're wonderful in that they're one pagers and really easy to share on social media. These are on our Canadian Grief Alliance webpage as well, if anyone ever wants to access them. Next slide. We also, as Paul was talking about, needing some infrastructure across the country and a bit of a framework for all of us to know and talk with each other and share ideas. We have created a national grief network across the country, where I'm quarterly kind of hosting a meeting with anybody who's interested to kind of come together and tell each other who we are and what we're doing and what our concerns are. And each of those sessions has room and space for just that exchange and introduction and sharing. And then typically we have invited somebody to do a little bit of a psychoeducation. So presenting on something that's important to them, or something that they're studying or have been sharing in other circles with this National Grief Network. We have done 5 of 5 so far. We've got about 60 people registered, but the meetings tend to be really small. So I would love to see more people show up and help inform the conversation and the sharing of ideas. So that's the barcode to join us if you're interested. When I try to use the QR code, it says that's odd, the page. I'm sorry about that. I'm terrible at grief literacy. Sorry, at digital literacy. But if you go to the Canadian Grief Alliance webpage, there will be a place there where you can signal that you're interested in joining the network. And again, I would love to see more people there. I'm just aware, before we go to the last slide, that funny, Paul, we haven't signaled, I think one of the biggest projects that we're doing is the Canadian Grief Alliance, which is putting up a website. We're thinking now that sometime in the first week or so of April, we will be launching a new grief website in the country. It'll be called About Grief. I don't know .com or .ca, but About Grief, and I'm sure it'll be blasted all over social media. It will be a wonderful kind of repository of grief information and resources for the general public, but also for professionals to refer and resource for people that you're working with. And it'll also create a bit of, as people identify themselves or we discover, kind of a roadmap across the country, at least around grief services in each province and territory, like who's doing what with who. So there'll be some of that there as well. So please keep your eye out for that About Grief website as well. I think that will be maybe our last slide. I think there might be a closing poll and some thank yous still to go. So on behalf of Paul and I and the whole Canadian Grief Alliance team and the organizations we're representing, thank you so much for hearing what we're doing. I'm really looking forward to your questions and some dialogue. And even beyond this, feel free to reach out to us. I think the last slide might be another poll question, Joshua.
Yeah, we can do the last poll at the end, or
Okay.
I guess we can do it
So
now.
not until we do some Q&A. Okay, great. Sorry, Esther and Joshua, I'm new at the poll part.
That's fine. We can do it right now. It's coming in.
And maybe with the last minutes then, anyone have questions or things you want to share or surface with us?
If you have the link that people can sign up to, it'd be nice to put that in the chat. I wasn't
Okay.
sure if it's under Contact Us or if it's a different link.
Okay, I'll look, so you guys can field questions for a moment.
Oh, I see a raised hand there. Stacy.
Thanks. Hi, I had a question. I'm currently working in New Westminster and we don't have a dedicated hospice here. And what I find is the resources that we give people, I'll try and turn my video on. The resources that we provide for people tend to be online, and I'm wondering if you have any recommendations. I know that I'm sort of in the lower mainland here, but I'm just wondering, when I worked in Victoria with Marney, hi Marney, we would direct people obviously to the bereavement department at Victoria Hospice. And I'm not aware of anything like that here. And I'm just wondering where you would recommend we direct people who might not necessarily have a lot of access to the internet. They might be elderly and that can be a bit of a barrier for folks.
Sorry, Paul, are you hoping I respond? And I was totally in another land trying
Yeah,
to.
yeah, I was hoping
Okay,
you'd
Marnie.
respond because it's about non-digital resources, specifically they're out in BC. I'm in Ottawa, so I'm not going to be.
Okay.
Yeah, BC or the lower mainland.
So sorry, Stacy, looking for like print stuff?
I guess so, or even just an organization that I can direct people to where they might be able to get support that isn't necessarily exclusively online.
Right, right.
In Victoria, I would direct everybody to you and the bereavement services at Victoria Hospice. And we don't have a dedicated hospice here in New West. So
Right.
we don't have a dedicated bereavement resource for people.
Yeah, I guess I would say, and I think this may not be what you're hoping for, Stacy, because probably you're already aware, but the BC Bereavement Helpline is a nice database for people. So you could just phone and say, I'm living in New West and I'm looking for grief support. Point me to what's available in my community. And the BC Bereavement Helpline volunteers would at least be able to identify something sort of in proximity to people, really in the whole province. So that's useful to anybody.
Okay.
They have a bit of material on their website. Again, that's an online kind of thing, and they do a lot of online supports. But they also have a helpline. So for people in New West who maybe don't need formal counseling, but are looking for kind of a trained ear and a kind listener, the BC Bereavement Helpline has hours every single day of the week where people can phone and seek support around grief and loss. So I would suggest that. I don't, maybe Joshua has some ideas about mainland grief supports, but some like Victoria Hospice, as you know, all of our grief stuff is available to print off. So, if people can get into a library to know Victoria Hospice has a menu of probably 20 different grief-related pamphlets and brochures that people could walk into a library and print off and have for themselves at no cost. And I'm imagining other hospices may have similar resources. So those were my first thoughts. I don't know, redirect me if I'm not really getting to what you need.
No, that's helpful. I just haven't found outside of Victoria that we're just as well resourced as I was used to. So I have often felt a little bit at a loss of where to direct people or even how to support the nurses that are working directly with people here on the lower mainland when they do make those bereavement calls to clients in the community and feel sort of at a loss about where to direct people. And, we do have a bereavement package that we send people, but I just, an organization that we can direct them to where they can have access to clinical counseling and things like that. It just feels like it's such a huge gap that we don't have available for people.
I agree, Stacy. I see it. I recognize it. I think we heard that in our consultations. Again, this is online, so not what you need, but just broader for everybody. Canadian Virtual Hospice has a feature called Ask a Professional, where a person can write in a question and it's responded or triaged to kind of a team of hospice end-of-life people, from physicians and nurses to spiritual health and counselors. So when a question comes in, someone sort of gets a sense of what's the nature of this and hands it to the most relevant or appropriate person who crafts a response, and then the rest of the team weigh in if needed on that response. So it's not immediate, it is online, but you do have access that way to professionals. So that's one resource for people in more isolated communities who do have some online access. As you, I'm sure, are well aware, Virtual Hospice has a ton of excellent modules online for people. And just more broadly for everyone, Virtual Hospice has a kind of section of their website called the Learning Hub, which has some excellent grief training and information modules for different professional groups. So there's stuff for first responders, ambulance people, there's stuff for social workers, and there's stuff for kind of healthcare provider general. A series of modules with information and tips and strategies and video clips. So those could be something as well for the team themselves.
I see in the chat there's a question about MAID, and we are the website we're launching will have resources there related to MAID, but Marnie, you're much more of an expert on that than I am.
Okay, I'm just writing into I've put just the link to the Canadian Alliance, Canadian Grief Alliance webpage, Contact Us, and I would use that Contact Us feature for anybody who might want to join the Grief Network, and just in the message say, sign me up for the Grief Network, and then you'll get the invitations. It's not an obligation to show up or be there, but you'll at least get the invitation that way. So might have missed it, had to step out. Can you advise if you're aware of resources or research that's looking at grief related to MAID? Clinically, it seems different than grief related to natural death. Wondering. So this is an invitation for others to respond. So if others have thoughts and experiences with this, please go ahead. Advise if we are aware of resources or research. So there is a lot of research happening around assisted death, and I would say even assisted death and grief. CAMAP, if you look up that abbreviation, CAMAP, is a group of MAID providers and assessors doing research and consultation and support. So I would look there. I, as part of some really wonderful kind of collaborative experiences, got to be part of a kind of quality, a kind of QA project, and also some research around grief and MAID. So we did publish an article in Death Studies about people's experiences of grief after MAID a couple of years back. So there, I know that study's there. If you use my name in Google Scholar, you would find that article, but there's been other great stuff since. So I think you can go to Google Scholar and look up grief following assisted death or medically assisted death, and find that I think there is a fair number of research studies coming out around this. I also would point to, again, as part of this QA project that I got to be part of in BC with Island Health, we created a little kind of pamphlet booklet that's grief related to medical assistance in death. And it has sections for the person themselves going through grief related to their choice of assisted death, and also for family members. And it has attached to it a bunch of related resources. And you can find that on the Island Health website. If you look up MAID Bereavement or MAID Grief, you'll find that pamphlet.
One of you was raised the question of services for adolescents, and that's something that's close to my heart because my kids were 10 and 14 when Suzanne was diagnosed with breast cancer. So they were 14 and 18 when she died. Very hard to get services. It was very hard to get support for them. And in particular, I'd say my son was overwhelmed by anticipatory grief. I think my daughter was maybe a little bit more in denial and suffered even more after Suzanne died. But really, we for the most part, we were reliant on the guidance counselors at schools, which are, they're mainly occupied in fixing people's course schedules and preparing people for university. And Suzanne died in September. That is not a good time to be trying to get into the office of the guidance counselor who's dealing with everybody's schedules in the entire high school. That this is one of many, many places where we see a a failure of this. I don't even like to call it the system because there isn't a system. There's people doing tremendous work like Marney and Josh and others and all around the country, but they're like bits of ink on a blotting paper, right? Like they don't like sometimes they reach together and touch, and oftentimes they're big patches where no one is touched, and it's not just adolescents, it's children and so on. One of the things we saw in other countries that it was a kind of public health model, and some of you may have heard this term, the Irish pyramid. It's called different things in different parts of the world, but basically the idea is if you categorize people who are suffering from grief, the majority of people will get through and return to kind of the trajectory of their lives with the support of the support of family and friends. And what we really can do for them is primarily around literacy, about teaching them, whether it's in school, whether it's on the radio, whether it's on TV, whether that's talking with others, to teach them about the nature and of their own grief and how to help others who are grieving. There's a smaller group who may need a more intensive support through volunteer-led support groups and this kind of thing, or websites and so on. And then in most, and we don't have good research in this country, but in other jurisdictions like Australia, Ireland, and the UK, they've identified about 10% of people who are grieving who have, and I'm going to get the terminology wrong, Marnie, but complex grief. It keeps changing. So complicated grief, or that basically they're suffering in a way that requires more intensive professional counseling. And we're not at the stage in this country where we can even look at our, as I say, system and say, are these different groups of the population getting the support they need? We are so far from adequately resourced. And, one of the things I think, if we had something like a Grief Canada similar to a Grief Australia, would be to start identifying where the priorities are. If we're going to have some resources, where is the need the greatest? Because the needs are so vast, and even as we elevate, I hope in years to come, resources we have devoted to counseling and other forms of support. We're not going to we're nowhere close to the point where we can say we've got a system that's supporting adequately the population of Canada who are suffering from grief.
Mm-hmm.
Well said.
Joshua, I have a question for you.
Oh, okay. All right.
When you listen to this presentation and you see some of the recommendations, particularly that Paul is, or the issues that Paul's naming there, do you see any kind of synergy with what the BC Centre found in their bereavement work and research?
Yeah, I definitely do. And I think it's just, what do you do with the information once you collect it is my thing. And like, how can we get other people who haven't heard about this or haven't heard about where to find the materials? How do we just get them like a one-stop shop to understand, get the materials, all that sort of stuff, where they get support? I think that's the challenge. I think there's enough research out there that we can really move the needle on getting people to increase their grief literacy. But now it's like, how can we um, get organizations and workplaces and other places like schools to understand what's already been done? I think that's just the issue that I think we're all having, is how do you sort of convey that that knowledge to people that have never been really taught about it in their schooling or in their programming. And so it's hard to just say, just Google it or whatever, because there's so many organizations and sites, and you want something that you can trust. And I think that's probably for me, it's like if we can design something like what you guys are doing, the Canadian Grief Alliance, that people can say, I trust this organization and the material they're providing. And then that's a way that people can just utilize that, that website or that link to just be the thing to hand it out to all over Canada. And I think that's, hopefully the way we can get going. But we first have to talk about it and work together. And so I think that's what, we're trying to do here.
Yeah. Yeah.
And so time is running out. I had a bunch of different questions for you, but I just want to sort of put it in that I thought it was really interesting about with men in grief and how they don't feel supported in hospices. And I think that's something that we should probably do a talk on like what are the ways men want to be supported and how can we do better? I know, Paul, if you had anything quickly to say on that.
Well, just to say that we're doing a webinar in the middle. I don't have the details in front of me, but I hope we can maybe get them to you and you can pass them along. But we are doing a webinar on men's grief in the coming weeks, and I'll be joined by my son, and we have representatives from other groups and orientations towards men's grief. So I hope some of you will be interested in that, and we'll for sure we'll get you the link and the coordinates to that.
That's great. Thank you. Yeah, we'll put it in the show notes, or the presentation notes. Okay, so thank you again, Marnie and Paul, for just taking time out of your busy schedule to just be with us today and share your knowledge, but also doing the great work you're doing. And we need more people like you to be able to do this work and be able to spread it. So thank you again just for the presentation and being here. Next, so we do hope everyone else enjoyed the presentation. We will ask you to complete a short survey if you have time at the end when you close the Zoom meeting. And registration for the next session in the series is titled Walking Through Grief Together, Supporting Family Caregivers Through the Transition to Healing. And that's scheduled for March 26th at noon. And so that link will be put in the chat box. And then to be notified of any other sessions in this series, you can subscribe to the BC Center for Palliative Care newsletter. And our aim is really to have this presentation recording and any kind of summary notes and resources to you within 7 working days. So just keep an eye on your email for that. And so once again, thank you everyone for joining us and caring about this topic enough to be here today and spend time out of your busy day to learn a little bit more about what's going on with grief in Canada.
Thank you so much, everyone.